Welcome to our educational video on respiratory failure. In this comprehensive guide, we'll explore the different types and causes of respiratory failure, shedding light on this critical condition affecting the lungs. The respiratory system plays a vital role in supplying oxygen to our bodies and removing carbon dioxide. However, when the respiratory system fails to function properly, it can lead to respiratory failure, a condition where the lungs cannot adequately oxygenate the blood or eliminate carbon dioxide. First, let's dive into type 1 respiratory failure, also known as hypoxemic respiratory failure. This occurs when the oxygen levels in the blood are significantly reduced. It can be caused by conditions such as pneumonia, acute respiratory distress syndrome, ARDS, or high-altitude sickness. Next, we have type 2 respiratory failure, also referred to as hypercapnic respiratory failure. This occurs when the lungs cannot effectively eliminate carbon dioxide from the body. Chronic obstructive pulmonary disease, COPD, severe asthma, and neuromuscular disorders like muscular dystrophy are common causes of type 2 respiratory failure. Now, let's explore some of the common causes that can lead to respiratory failure. Pneumonia, a lung infection, can severely impair lung function and oxygenation. Chronic lung diseases such as COPD, emphysema, and interstitial lung disease can gradually lead to respiratory failure over time. Additionally, factors like severe asthma attacks, acute respiratory distress syndrome, ARDS, triggered by trauma or infection, drug overdose, chest trauma, and certain neuromuscular conditions can all contribute to respiratory failure. Treatment for respiratory failure depends on the underlying cause. It may include supplemental oxygen, non-invasive ventilation methods such as CPAP or BiPAP, or in more severe cases, mechanical ventilation with a breathing machine. Addressing the root cause, such as treating infections, managing chronic conditions, or providing supportive care, is crucial for successful recovery. Prevention plays a significant role in minimizing the risk of respiratory failure. Maintaining a healthy lifestyle, quitting smoking, avoiding environmental pollutants, and seeking early medical intervention for respiratory symptoms can all contribute to lung health and reduce the chances of respiratory failure. We hope this video has provided you with a better understanding of respiratory failure, its types, and common causes. Remember, early recognition and proper management are essential in improving outcomes for individuals affected by respiratory failure.